Hello, good evening, and welcome to the Functional Medicine Discussion Podcast. My name is Tal. I'm the Educational Director at the American Academy of Functional Health, and with me we have Dr. Chill.
Hi, everybody. Welcome.
So hopefully you're having a good day so far and a good start for 2025. And again, Happy New Year to everybody here, to you and your families. And as usual, we're coming together every Wednesday evening, myself and Dr. Chill, and to bring you the most updated and most current treatment strategies for chronic conditions. And if you are interested in learning more about the root cause, then you're in the right place. Today, we're going to talk about the root causes and mechanisms and pathways and some great strategies you can already apply for and help your patients when it comes to one of the most common chronic conditions, which is neuropathy. So, Dr. Chill, I know that you've been a functional medicine physician for over a decade, and I'm coming from a running and working in healthcare for almost 20 years, using functional, nutritional, integrative medicine, herbal medicine, just like yourself. So we're all seeing those patients, right? The neuropathy patients, right?
Yeah, and pain can be so debilitating for our patients. And so many of those patients who come in and see us, they might not even know that there are other alternatives and other options for them besides pain medications that they can do to help with their pain and actually manage their pain more long-term than the medications. And this is really exciting to kind of go through this information so you have these tools to help your patients with their neuropathy pain as well.
Absolutely. And it's interesting to mention that working with neuropathy patients could be one of the most frustrating or most rewarding experiences we can ever have as providers. And I'm saying that taking under consideration that we have seen lots of autoimmune conditions, we've seen mood disorders like anxiety and depression, we've seen so many different conditions, right? But when we talk about neuropathy, I always remember those patients that came in, and when I asked them what they tried and what didn't work, some of them just started crying because the experience of ongoing pain that is either sharp or stabbing or the burning sensation, right? It's for some of our patients that could be random. For some of our patients, it will keep them up at night. And for some patients that I've talked to, and you might have had the same or similar experience with your patients, I've had patients, older patients, who told me that the pain is driving them crazy. They're on the maximum amount of gabapentin. And I'll never forget this one lady that came in. She was such a nice lady, very polite. She used to be an engineer. She came to me. She was retired in her 70s. And she told me, listen, you're my last resort. Like, if you can't help me, then I'm just done, because I cannot live with this pain anymore, right? And so talk about no pressure, right? so that's where that was about the time where we had amazing reputation as the detectives in functional medicine, right? In our practice, we had physicians and nurse practitioner and nutritionists and acupuncturists, and we offered this integrative approach. And we would really see patients that have been everywhere. They tried everything, and they heard us as sort of like, if you can't figure out your health solutions or you can't figure out your health problems, you should go see these guys, right? So that's how we would get a lot of those clients. So there's a lot to cover when it comes to neuropathy. We know that it's very common. What I want you to get out of our discussion today, and there's going to be some really cool studies we're going to go over, and some really cool mechanisms, and some of them are a little bit more simple and some a little bit more complex, but we're going to try, both me and Dr. Chill are going to bring it all together for you so you can already use it tomorrow, right? So we want to stay on a clinical and applicable side. And another reason why we pick neuropathy is because it's so common. We're talking about statistically roughly over 20 million Americans that have moderate to severe type of nerve damage and neuropathy. And we know that when we look at surveys, I just looked at a couple of surveys earlier today, there's surveys that showing that with diabetic neuropathy, around 35 to 50% of those patients develop neuropathy. So they looked at diabetes patients and they found that 35 to 50% of those patients develop neuropathy. So it's a lot of your patients. So think about this: if it's about 50% of the diabetic patients you are currently seeing could develop neuropathy, right? That's what the statistics are showing us. So we want, as healthcare practitioners, we want to understand neuropathy. If we can prevent it, even better. But if they're already suffering, then we want to have tools in our toolbox so we can help them beyond just giving them a pain medication and sending them home, hoping and praying that they would get better. And we know that health doesn't come from more drugs, right? To stimulate better health, we have to guide the patient to the appropriate strategies to start restoring their health, right? That's what they're coming to see you. That's what they're paying you for, right? So in today's discussion, we're going to talk about the 4 major factors that you need to know about when you are dealing with a patient that has a neuropathy. We're going to talk about some supplements. We're going to talk about some natural solutions to neuropathy. So it's going to be awesome because you're going to learn a lot and you're going to be able to use it to help your patient. That's what we're all about. So let's get started. We're really excited about this. And so the factor number 1 that we're going to go into is inflammatory foods and neuropathy. So you can see we're going to talk a lot about inflammation. Inflammation is a key player in nerve damage and neuropathy. We're going to talk a lot about the inflammation and neuroinflammation and all of that stuff. And you can see today I'm wearing my red shirt, which kind of matches that inflammation that we're going to talk about, right?
That's right. And I'm wearing apparently the blue shirt. It's a darker blue, but I guess this is representing the anti-inflammatory effects that we're going to be discussing as well.
Exactly. So we're going to talk about the pro-inflammatory and how we identify those triggers, and then Dr. Chill represents the anti-inflammatory. We're going to talk a lot about that as well, and that's sort of like the yin and yang of our conversation today, right? The inflammation and the anti-inflammation. So let's go into factor number 1, inflammatory food and neuropathy, and we're going to start with a little quiz for you, just to warm you up, right? So which of the following is not true about chronic inflammation? Option number 1 is chronic inflammation is important for repair of tissues. Option number 2 is chronic inflammation increases oxidative stress. Option number 3, it contributes to cardiovascular diseases. And option number 4, it can be measured with levels of CRP, ESR, and interleukin 6. And ESR, just as a reminder, it's erythrocyte sedimentation rate test. So which of the following, I'm going to give you a few seconds to process it and think it, which of the following is not true about chronic inflammation? Is it A, B, C, or D? You can put it in the chat. I'd love to see your guys' comments. Okay, so the correct answer is number 1, A. Chronic inflammation. While inflammation, this is really important to remember, while inflammation is in the initial part of our body's response to injury, tissue damage, infection, if you have a patient with prolonged, or what we refer to as chronic inflammation, it could lead to tissue damage, right? And an ongoing inflammation would lead to tissue destruction while the body is trying to heal, which ultimately it just impairs the proper repair process and potentially can cause either scarring or tissue damage instead of restoration. So that's something that's really important to remember when we talk about inflammation. It does increase oxidative stress. It does contribute to cardiovascular disease. And you can measure it as a C-reactive protein, ESR, or even interleukin 6. There's not just one way to measure inflammation. There's different players when it comes to inflammation. And we have to remember that clinically. So let's talk a little bit more about inflammation and how does chronic inflammation or even subclinical chronic inflammation can lead to nerve damage. So this is a really interesting picture I wanted to bring to you from an article published in the Journal of Antioxidants just recently, just in 2024. And in this picture, you can see the direct connection between inflammation, neuroinflammation, and nerve damage. So let's start from the bottom. This is where you see direct injury or systemic inflammation, right? So systemic inflammation triggers, and we're going to follow the arrow on the right side, triggers the activation of DAMPs, which are essentially our damaged associated molecular patterns. And these, some of the examples are amyloid beta, fibrinogen, right? So there's different types of damage associated molecular patterns. Now, this is done through pattern recognition receptors, which the authors here noted on the top right as PRR. So those are pattern recognition receptors, right? So some of the examples are toll-like receptor 4 or inflammasomes, which we talk a lot in our functional immunology class. So the next step involves, on the top, involves the microglia. And if you remember, if I take you back to biology 101, that for some of us was a long time ago, microglia is an immune cell. And at this point, with the activation of microglia, we already have what we call neuroinflammation, right? And microglia is an immune cell, as I mentioned, which is deeply involved in the maintenance and homeostasis and play a role in both normal repair of nerves and pathological reactions, right? So we typically, what all remember in biology is that microglia is found in the brain, right? In the central nervous system, and helps to fix nerves, right? Play a role in fixing nerves. But activation of the microglia could lead to a secretion of reactive oxygen species, right? And inflammation. So if we got signals of inflammation, what will happen is the microglia in the brain and in a peripheral nervous system, right, will transduce in the microglia by nuclear factor kappa B. And that will activate the microglia to produce superoxide. Now, superoxide is one of the primary reaction oxygen species. And it's a molecule that contains oxygen, and it's highly reactive due to its partially reduced state. Now, we're not going to get into the different those different mechanisms, so we're doing a very wide, kind of broad overview. But just what I want you to take from this is that if there's systemic inflammation that is prolonged, it will activate the microglia. And we're not going to get into it today, but we're also talking about activation of the microglia beyond the blood-brain barrier, which can impact neurodegenerative conditions. But for sake of the conversation we have today, we're going to talk about the peripheral nervous system. So the microglia is now activated, and it's starting to produce superoxide, which is essentially reactive oxygen species or free radicals, and it starts destroying the tissue, right? That's what we call a state of oxidative stress, right? So in our body, we got two mechanisms that we want to take a look at: antioxidants, which protect our cells, and oxidative stress or reactive oxygen species, right? Which could damage our tissues and cells. So both neuroinflammation, the state of having high inflammatory markers, activated microglia, or inflammatory cytokines, and oxidative stress have a significant effect on the neural tissue. It can cause neural death. It can promote neurodegeneration in the peripheral and the central nervous system. If you want to read more about it, you're welcome to, we put the citation on the bottom. The study is called Crosstalk Between Oxidative Stress and Inflammation Caused by Nose and Air Pollution, an implication for neurodegenerative diseases. Now, when it comes to clinical application, if we want to help patients on a deeper level, we must find out what's driving that systemic inflammation, right? There's multiple factors, and some of them we're not going to talk about today, right? Like gut health, environmental factors. There's multiple factors that can cause that. And this is exactly what we teach you in the Advanced and Clinical Functional Medicine program, right? We teach you how to identify those. We teach you specific protocols for each chronic condition. Now, the good news is that there's a lot that we can help those patients. We can help guide those patients to change their physiology and function. And diet is one of the things that play a major role in how much inflammation we have in our body. So let's take a look at a visual summary of what's considered a pro-inflammatory and what's considered an anti-inflammatory diet. This is from the Journal of Nutrients. It was published in 2023. So I love this picture because it's a very simple, straightforward way to look at what could trigger inflammation. So overall, a plant-based diet, or even a diet that is high in vegetables, fruits, and whole grains, let's call it Mediterranean diet, we can call it a vegetarian diet, right? With moderate consumption of legumes and fish, right? With low consumption of red meat and processed food, is known to have anti-inflammatory effect, right? Now, on the other side, we have the pro-inflammatory diet, which has high amounts of sugar, red meat, processed meat, different snacks that have maybe processed flour or sugar, right? And then we have low consumption of vegetables and fruits and whole grains. Unfortunately, when we look at the right side, what type of diet comes to mind when we look at these pro-inflammatory diet, right? Can you think about something, one of those diets? If you said the standard American diet, or SAD, you're right. These are the components of the standard American diet. And so many of our patients come to see us every day looking for solutions for their problems. And you might prescribe them a pill, right, for neuropathy or for other chronic condition. And we don't think about the fact that those patients are going to go home, they're going to take this pill that's supposed to help with pain that is caused by inflammation, and they keep eating inflammatory food. They keep eating food that is high in processed chemicals, they eat food high in sugar, they eat very low fruits and amount of fruits and vegetables. So they keep flaring up that inflammation, right? So it's important for us, all of us, to understand how is this work, and how we can help our patients. And you don't have to be the person that sits with them and explain to them about inflammatory diet, anti-inflammatory diet. It's okay if you don't have the time to do it. But I would recommend to have two options. One is you either refer them to a functional nutrition coach. We have lots of functional nutrition coaches that are in our coaching program, or you can even hire somebody. Like in our office, in our practice, we had somebody who was a functional nutritionist, and they would work, the physician, the nurse practitioner, or myself would do a review with a patient, write the strategies, and then we move them along to do the weekly sessions with the functional nutritional coach, right? So that's another option, right? But it didn't take us typically more than 5 to 10 minutes to explain to patient and say, you're eating inflammatory food, it could flare up your condition. Here's a 1 page. You can even copy paste this from the study, put it on a page, give it to the patient, and say, here's what I would want you to start working on to reduce and increase those anti-inflammatory foods. Now, there's a really interesting meta-analysis. They took 17 studies from 2,300 subjects, and they found that individuals that applied these principles through a Mediterranean diet were found to have lower levels of inflammatory biomarkers in their lab tests, such as lower CRP, lower interleukin-6. That's how we help our patients in the long term. And you can read more about the systemic review study in the description. It's called Mediterranean Diet Patterns, Inflammation, and Epithelial Function. It was published in 2014. So the first thing we want to do is have educate our patients that when they're eating pro-inflammatory food, it could flare up their condition, right? We have a lot of studies that already show that. So that would be our first and most important factor. Now, you don't have to get to it on your first appointment with your patient. You can kind of plant the seed as you see them, right? So we would have all of you in our program can download the functional medicine program for your patients. And it has 7 simple steps. Every week, every 2 weeks, every month, they can take one step. It comes with a recipe. It comes with simple explanation of why are they doing what they're doing, so they understand. So you can go into your practitioner toolbox in our platform, just download it. You can even put your own logo or name on it, and then make it yours and start using it for your patients, right? So that's a really great tool you can use. Otherwise, you can just print this, give it to your patients, right? So, Dr. Chill, I feel like diet is a big topic. We can talk a lot about diet, but hopefully that gives them the kind of a general guidelines.
Absolutely. And it's those pro-inflammatory diet actually leads into the next factor here. And really our job is to educate our patients, because the more they know, the more they're going to feel empowered to make those changes in improving their health. And this kind of goes into factor 2, as this is a major education point that we can discuss with our patients so they understand what is happening and what can be triggering their neuropathy pain and how to properly manage that. So factor number 2, again, leading from factor number 1 with the pro-inflammatory diet, if they're eating too many pro-inflammatory foods, what occurs? They increase their adipose tissue and they become overweight or obese. This is another important factor in neuropathy, because excess body weight or obesity is a triggering factor in their pain. But let's start with a short quiz before we dive into the discussion here, so we can test your knowledge a little bit on fat tissue. Let's pop up the question here. Okay. So the question is, which one is not correct about adipose or fat tissue in overweight or obese people? A, creates pro-inflammatory cytokines, which increases inflammation. B, it secretes the hormone leptin, which regulates body weight. Or C, it secretes growth hormone, which induces tissue growth. And again, the key word here is which one of these is not correct about adipose and fat tissue. We'll give you a couple of moments here and you can put your answers in the chat. All right, great. Well, if you answered C, that is the correct answer. It is C, adipose tissue does not secrete growth hormone. And we'll kind of dive into what adipose tissue can do in terms of what it secretes and how it is correlated and can trigger neuropathy pain in your patients. So what happens with adipose tissue is that when there's an increase in adipose tissue, this can actually increase the immune activation of inflammatory cytokines. And aside from the metabolic neuropathy that can occur with increased adipose tissue, this is further associated with chronic inflammation, and this is a direct link to hyperalgesia. And this is when your patients are more sensitive to pain than normal. And with that, that can worsen not only their existing neuropathy, but other sources of chronic pain as well. So I want to show you a picture from the Journal of Pediatric and Gastroenterology and Hepatology and Nutrition. And here we can see that adipose tissue is now recognized as an active, as it secretes a variety of adipokines and cytokines, both anti-inflammatory and pro-inflammatory cytokines. Like Dr. Cohen and I, we have the pro-inflammatory red shirt and the anti-inflammatory blue shirt here. So this happens with the adipose tissues as well. But here is the kicker. This is what the research is showing. When your body starts to hold on and increase its adipose tissue, we can see on this image here that it actually will start to go into the pro-inflammatory cytokines, and it starts to increase inflammation. And some of those cytokines include the TNF alpha, the IL-1, the IL-6, interferon neuron gamma. What the good news here is, when you are educating your patients that when they have an increase in these adipose tissues from their pro-inflammatory diets, we can start to give them protocols to decrease that adipose tissue. And what happens when you start to decrease that adipose tissue? Well, what the adipose tissue will start to do is it starts to excrete more of the energy metabolism and immunity, such as the leptin and some of the anti-inflammatory cytokines to decrease inflammation, such as the IL-10. So it's extremely important to understand that maintaining a healthy weight, choosing those anti-inflammatory foods, and providing your patients with an anti-inflammatory food list or a guideline, or having them work with a functional nutrition coach will be very beneficial for that. And then having them stay physically active. These are all important aspects of the lifestyle and of the lifestyle approaches that we often incorporate for our treatments with our patients. And this is important in reducing chronic inflammation. And this can help with the chronic pain, including nerve pain associated with neuropathy. But if you're interested in learning more about the root causes of metabolic dysfunction and weight gain, and how to actually identify them and all of the specific strategies that you can use and the treatment strategies that you can use, we actually invite you to check out the Functional Weight Loss Certification Program. This is an online 8-week program. It's actually pretty short for a program, and it's going to give you all of the information that you need. You're going to have live and on-demand classes, and it's going to be focused, extremely focused on weight loss with the functional medicine approach. We're also going to talk about specific labs and then how to promote your own weight loss program. So definitely ask about that weight loss program if you are interested in learning on how to use the functional medicine approach for weight loss.
Awesome. Yes, and we're gonna post this. We're gonna post the link, so you should be able to see it, and we're also gonna post it in the chat for any of you who are interested. We do offer a special scholarship and a special discount to our community members who want to get certified. We're starting the first month of February, so it's a pretty awesome program. We're really excited about it. This is like a very unique program that kind of dives into the 5 major root causes for metabolic dysfunction and obesity. So every week, we're going to meet up for about an hour, either myself or Dr. Chill. It's going to be like a small group. So we have limited seats because we want to keep it a small group. And it's more interactive. So we're all going to be on a call. You can ask questions. We're going to show you some cool lab testing, both genomic and functional medicine, case studies. And then there's about an hour or two of about 2 hour, like on demand, where you can kind of watch and go through it every week on your own whenever you want. So it's a pretty awesome program. And then you get certified as a functional weight loss consultant. So thank you for that, Dr. Chill. I feel like that was really good understanding how if a patient has a larger tissue, adipose tissue, we know physiologically that it will contribute ongoing every day will contribute to the secretion of those inflammatory cytokines. So that's another way to help them with metabolic dysfunction, is to learn more about how we can help them to reduce fat tissue, not just for medical purposes, but a lot of patients are looking for it. They want to look better, feel better. It's just a really big part of what patients spend a lot of their time and money on, right? So why not offer it in your practice? So let's dive into factor number 3 that causes neuropathy or contribute to neuropathy, and that is nutritional deficiencies. Now, we know that diet, we already talked about it, plays a really important role in metabolism and our function. And we talked about it, the patient eats inflammatory foods. It could trigger chronic inflammation. But we also know that specifically, there are very specific nutrients that we must consume, right, in order for our nerves to function properly. For example, we know that if one of the signs of B12 deficiency is numbness, right? And we all learn about this. This is, it's not something that is new. What we don't learn is in more detail about what are the specific nutrients that we want to make sure that a patient with neuropathy is taking and absorbing properly to make sure that their nerves are functioning. And then I'm also going to show you a really cool study on how what they should consume in different stages of the nerve injury. So let's bring this really cool study that I found from you. This is from the Journal of Frontiers in Surgery. It was published in 2022. And so on the top, there's 3 parts to this. So on the top, we can see the predisposing factors. In red, we can see the factors that the authors call it downgrade, but essentially the authors the factors that can contribute to neuropathy, right? So those would be patients that are deficient in B vitamins, that could be being overweight or obese. And now you know why. Dr. Chill already covered that in the previous section. And then high-fat diet. According to some report, high-fat diet has its disadvantages, right? And so those can contribute to inflammation and nerve damage. On the left side, we can see the predominantly neuroprotective nutrients, which can be taken from the time that there's injury, right? The injury occurred. So you can see here alcohol, that's pretty self-explanatory. Alcohol is a damaging agent to our nerves. And then marked in green, you can see B vitamins, really important for the function of the mitochondria inside the nerve cells. Vitamin C is really important for regeneration of pretty much every tissue in our body. You got vitamin E, which has a powerful antioxidant property. You got magnesium, you got omega-3s and 9s, and they're all required for nerve function or nerve integrity. Now, we're not going to get into each one of them and the mechanisms, how it works, right? We know that omega-3 has more omega-3 has more anti-inflammatory, more omega-6 has more pro-inflammatory. That's why you don't see omega-6 in this picture. Now, the authors also marked green tea and melatonin as beneficial agents because they have a strong antioxidant and neuroprotective effect. So, and then on the right side, these are neuroregenerative compounds. That's how the authors refer to them as, that could be taken after nerve damage. So here the author said divided it into injury and then surgery, right? So after surgery, you could consider recommending some of these, which is after the nerve damage already occurred. So good quality fats are really important. So that would be olive oil, that would be omega-3s. Those are associated with less inflammation and less damage to the tissue, right? Complex carbohydrates, such as whole grains or legumes, are really important. Again, that takes us back to the kind of Mediterranean diet style. And so these are not necessarily gonna stop inflammation in the same way that an ibuprofen would, right? That NSAID would, or prednisone. What they would do is they would modulate the immune reaction, so we don't get that prolonged, ongoing chronic inflammation that can lead to oxidative stress and more damage to the nerves, right? It just allows, essentially what we're trying to do as healthcare practitioners is create a healthy environment in which our patients' bodies can do what they're designed to do best, which is to heal and repair, right? That's our original design, that you can call it given us by a higher power or God, right? That's our original design, is to, and healthcare practitioners, we're not actually going in and reconnecting the nerve or regenerating the nerve, right? We provide a healthy environment for the patients to heal. That's what we're trying to do. And then other nutrients that were mentioned here is vitamin D, folic acid, creatine. Those are also really important. Now, the simplest way that we can apply everything that this is discussed in this study is by giving them a really good, high-quality multivitamin. And I'm talking about high quality. I'm not talking about the ones they sell in GNC store or Walmart or Spectrum, right? No offense, and I'm not, I don't want to bash any of those companies, but when we talk about high quality, we want to talk about professional grade supplement companies like Pure Encapsulation, Douglas Laboratories. Those are companies that have third-party testing. They have methylated B vitamins. They ensure that there's improved absorption, of course. And then 2 to 4 grams of omega-3 supplementation every day. That's really where we want all our patients. right? That's in regards to this section. So that's essentially when we talk about nutritional important nutrients, we want to make sure that the patient is given its body everything that his body need in order to function better, to regenerate better, right, and heal. That's what we're trying to do, right? So that leads us to the fourth factor when we're talking about neuropathy. I know there's a lot of information here, but I want you guys to do the best for and get the best clinical outcome for your patients. So, Dr. Chill, I know that this is a big topic.
Absolutely. And I'm glad you brought up, providing the right environment for the body to heal. And that includes ensuring that it doesn't have certain things within that environment that are preventing it from healing. And that actually leads to factor number 4. And this isn't often talked about in the conventional standard. And these are environmental toxicants. And there's so many types of chemicals that are found in our food, our water, our air, our products, our cosmetic products. They're all around us. And what happens is when there is a buildup of these products, it can actually prevent us from healing, and it can prevent us from having that environment that Dr. Cohen was talking about that allows for that healing and that optimal health. And for this discussion, we're going to talk about one specific type of chemical. You may have heard about this. It's bisphenol A, or BPA. And according to a published article from the Journal of Archives of Toxicology, and this was done in 2024, and it was showing that BPA exposure actually impairs and damages nerves, and it happens through several mechanisms. It's going to promote oxidative stress. It can change the expression of several crucial genes and proteins. It's going to increase neuroinflammation and has destructive effects on those neurotransmitters. It can damage the blood-brain barrier function, and then it can lead to neuronal damage and significantly reduce myelination. These are all parts of the factors that lead to exacerbating the pain, continuing to damage the nerves, and causing the chronic inflammation that is occurring in those nerve fibers with our patients. And this is done just by one chemical, and that's BPA. And there's many other chemicals that that can contribute to this as well. And so where we want to talk about with this one specific chemical, the BPA, where is this found, right? So let's do a little quiz to find out exactly where bisphenol A is found. So let's pop up this question. So which are the following sources of exposure that you can get exposure to BPA? 1, food containers and packaging. 2, baby bottles. 3, water bottles. 4, medical and dental equipment. 5, breast milk. 6, all of the answers except for 5. Or 7, all of the answers, or all of the above. We'll give you a few moments to go through these and figure out which one of these are all sources of BPA. And you could post your answers in the chat. All right. The correct answer is going to be number 7. All of these are possible exposures to BPA. It's all of them. And according to a study that was published in 2014 in the International Archives of Occupational Environmental Health, about 75% of mothers' breast milk samples had detectable concentrations of total BPA. So not only is the mother having overexposure to this, causing causing issues and health issues with the mother, but this can be leading to health issues with the baby as well. And I want to pop up another picture to kind of dive into this a little bit further and all of these sources a little bit further for you. And this was a picture that was published in the Journal of Frontiers in Nutrition. In this picture, you can see a few of the sources that we mentioned here, right? They're going to be some of the dietary sources, including the food containers, the packaging, the baby bottles, the water bottles, the lunch boxes, water tanks, microwavable utensils. And then there are non-dietary sources such as electronic equipment, paints, thermal paper, flame retardants that we see right there, medical and dental materials, sports equipment, printing inks, and even DVDs. And then we can even get contaminated through the landfill. We see this in the middle here, through our soil, our air, our water, our food, that can either be directly or indirectly exposed through those aspects. And this can affect the humans through these different exposure routes. So it's really important to understand what environment your patients are in, and you could do this through a intake form, and which will assess if they are at risk for exposures, or you can do this through testing, and we dive into environmental toxicants in further detail in the advanced and clinical functional medicine program, which will go into all of the aspects of environmental medicine, which is really, really important from a functional medicine perspective, because this is often missed, especially in pain management. And oftentimes we do see that environmental toxicants are a major contributing factor for our patients dealing with chronic pain.
I know that there's a lot more that we're diving into this during the advanced functional medicine program. Also, some of it when we talk about metabolic dysfunction next month, when we go into our functional weight loss certification program, which is a program that it's a functional medicine program where we really specialize in weight loss and weight gain, right? That's what we're really going to be focused on. I wanted to mention a couple of really cool things. One of them, that this is a study from 2022, and they mentioned CDs, exposure through CDs and DVDs. And I'm thinking to myself, when was the last time we have seen or used a CD or DVD? So I remember it's one of those things, right? You put in a box, there's like a hole in a box, and you just
I think it's considered vintage now.
Yeah, so that's hilarious. But it's yeah, I mean it's just all around us, right? So we really want to know. I know that's the second thing that you mentioned, is that we need to know about this. Healthcare practitioners need to know about this, right? Because we're all exposed to it in different levels, but we're all exposed to it. And I think it was Consumer Reports or something like that mentioned, it was like a few years ago, they did an article and they found that we all consume the equivalent of plastic, the equivalent of a credit card every week, right? So it's really interesting. It's just a lot of different plastic chemicals that we're all exposed to. So, and then one of the things that you mentioned is we do have a clinical evaluation tool, which is we license to our community members to use at no cost. They can use that as many times as they want, as many patients they want. And it's really where you easily identify and quickly identify what are the major triggers and root causes that lead to this patient's chronic conditions. So we call it the functional medicine evaluation tool. It's a screening tool. It's not lab testing. It's a screening tool. And if you're in our advanced functional medicine program for healthcare practitioners, I would highly recommend you to schedule a coaching call with Dr. Chill. We don't charge extra for that. We we give you all the resources to be successful. So you can, and it doesn't matter where you are in a program. Maybe you've just started with the new class that we just have a new class that have started now in January, in the last 2 weeks. It doesn't matter where you are, or maybe you're already advanced in the program, right? Doesn't matter where you are. I would highly recommend to book your coaching session with Dr. Chill and do a case study, like download that evaluation form. You can fill it up yourself. I use that form for my father. He was the first case study that I did with the form. You can use it on a real patient, right? So, and then bring it to Dr. Chill. We got a HIPAA compliant portal specifically to upload those if you want to upload more labs. And then Dr. Chill is going to do one-on-one with you session where he's going to show you how to use the clinical tools, the clinical guides. So in like 1 hour, you now get a lot of confidence in like, okay, this is how I'm using these tools, and start using it with your patients, right? So, so we're going to finish up with a supplement because I want to give you another clinical tool you can use. So when we talk about supplements, there's a lot of nutritional lifestyle strategies, herbal strategies, which are a little bit more advanced in the program. You go into herb pharmacology and how to use herbs instead of using drugs. But for now, I want to talk about one of them, right? One of those compounds, and that's alpha-lipoic acid. Now, alpha-lipoic acid is an antioxidant. It's a organosulfur compound that occurs naturally. You can find it in nutritional yeast, spinach, broccoli, potatoes, meat organs like liver or kidney. And the alpha-lipoic acid was reported in several studies to lead to a significant improvement in neuropathy symptoms. There's one particular clinical study, it was a systemic review study that reported that alpha-lipoic acid was found to lead to reduction in total symptom score and improvement in measurable nerve conduction. So there is some indication that it's not only helpful for reducing the pain, but it's also supporting the healthier function of the nerves. Now, what are the dosage consideration? So the study reported between 600 to 800 milligrams per day. It's important to know that most studies have used 600 milligrams per day, and some studies have used a simple oral supplementation while others used intravenous. So intravenous will typically be 600 milligrams. If you're doing a simple oral supplementation, one capsule is 600 milligrams. You can do that once or twice a day. And we have seen really good results with supplementation that involve alpha-lipoic acid. If we do a combined approach where we do a functional medicine evaluation session, help them to figure out what's driving that inflammation, and then over the course of the next 3 months, they take alpha-lipoic acid at 600 milligrams once a day for a minimum of 3 months, right? While we help them to start reducing some of the inflammatory foods that they're eating, we have seen reduction of pain between 50 to 100%, right? And I'm talking about some of them are really tough cases. They're maxed up on gabapentin. They try different things. They're taking NSAIDs. They're trying everything they can. And we've sometimes see 50, 60, 70, 80% reduction in pain, right? So it's like, it depends on how much the patient is compliant. It depends on your clinical skills and your communication skills. But, one step at a time. Like when you see the patient, you might recommend like one simple supplement, right? Like alpha-lipoic acid, maybe 600 milligrams or once a day or twice a day, right? And then over time, ideally, we would really want to sit with the patient and understand what's causing that damage, what's causing that inflammation, right? If it's caused by diabetes, then learn about what triggers diabetes, right? We teach that in the programs. So and then help them with some dietary changes. Remember, even simple strategies: add alpha lipoic acid, add, that's like one capsule a day. It's not even expensive. It's like you can find it's like $20 to $30. It's not very expensive, right? You can add a good supplement of omega-3s to help to mitigate some of that inflammation, right? We talked about 2 to 3 grams per day. So what we're looking for is simple strategies to help our patients during the first 3 to 6 months towards recovery, towards feeling better, while we help them to find the root causes of their disease or condition or symptom. That's why they're going to come to see you instead of keep on jumping from one doctor to another nurse practitioner to another specialist to another, and they still struggle, right? That's, by the way, why many of our community members are getting paid between $200 to $800 per one session, out of pocket cash, right? And so we want to offer a unique service to our patients that help them to restore their health, right? And as always, our goal is really not to get our patients to be dependent on any type of supplement or any type of drug. We always used to tell our patients in our practice that if we do a good job together, us and them, we do a good job, then we expect to see a significant improvement and reduction in their pain within the first 3 to 6 months. And we want to get them to the point where they understand what's causing their sickness. They know how to take care of themselves, right? Do self-care and carry on the improvements, right? Without needing us, without needing more drugs, without being dependent on us or anybody else, right? Because our number one goal is always to help our community, right? Now, that doesn't mean that you can't have a busy practice. That doesn't mean that you're not gonna, that you're not gonna get paid well. You will if you have the skills and and patients can find you. Then you're gonna get paid very well. We're here to help you with both, with the clinical practice, improving your skills, gaining more tools, and getting more better results, and also with the marketing and how to help you to get patients, open up your own private consultation practice. We're here for you. So this was Dr. Chill. I feel like we covered a lot, and
a lot of information, but very useful information that's going to help a lot of patients that really didn't have any alternatives before.
Yes, absolutely. And those patients, really, some of them, we know they're researching. Last time that I checked, how many supplements are there for neuropathy? Just on Amazon, there's like dozens of different types, and probably hundreds on like just everywhere around us. Most of them are just selling them like the idea of like a quick fix. And I've had patients even on Social Security, older patients on a limited budget and you might have seen it too. Those patients that come in and they're on a limited budget, but they come in when they spend like $200 or $300 every month on like a bag of supplements, right? And you ask them like, why are you taking this? I'll never forget those patients. They bring their bag of supplements, and I'm pulling supplements. I'm like, what are you taking this for? And it says, well, I read that this is good for my neuropathy. I read that this is good for my diabetes. I read this is good for weight loss. I read that this is good for whatever it is. And in most cases, it's just a very low quality product. Or I've seen products that have like alpha lipoic acid, and it says like research-based ingredients, right? Like these flashy headlines, and there's like 80 milligrams of alpha lipoic acid, right? So it's like, I mean, come on. I mean, that's not really gonna do much, right? So it's important for us as healthcare practitioners, and that's just my own. I know that my own philosophy, and also yours, is that we should continuously develop our skills. We should continuously be able to offer better and better guidance to our patients, because if we won't do it, who will, right? So So
Absolutely.
with that being said, I really want to thank Dr. Chill for being here, sharing his years of clinical experience with us. And I also want to thank our media team and Jacob for putting it all together, allowing us to be with you wherever you are. And I want to thank all of you for being there for your patients every day, being sort of like the light in the darkness, right?
Mhm, mhm.
So I really appreciate all of you. If you're interested in the new certification, the functional weight loss program, reach out to us. We're also going to post the link again in the chat. We get a special discount. We're taking a small group of practitioners. This is going to be a little bit more intimate learning experience. It's just 8 weeks, so it's about a couple of months, and you're going to learn a lot about metabolic dysfunction, how to restore your patient's health, and we're giving a really special discount for that program. So you can reach out to us if you're interested in more information. And I hope everybody will have a wonderful evening. Take care of yourself, and we will see you in the next class.